Hello, everyone. Welcome to AutismBC Talks. My name is Stella Hui with AutismBC. Today, we are happy to have Chelsea Jelic, Registered Speech-Language Pathologist from POPARD, that is the Provincial Outreach Program for Autism and Related Disorders, to talk about what a speech-language pathologist does and how they can help support your child, your loved one, or yourself. Thank you, Chelsea, for being with us here today.
Thanks, Stella. Thanks so much for having me. I'm happy to be here.
So, Chelsea, can you explain to us what is a speech-language pathologist?
Yes, absolutely. So speech-language pathologists are regulated healthcare professionals who are registered to practice in British Columbia through the College of Speech and Hearing Professionals. And so the main goal of a speech-language pathologist is to help people enhance their communication skills. So communication is very simply the sending and receiving of information. And so we use communication in order to achieve all sorts of things. And most of that has to do with connecting to other people. So we communicate to express our thoughts and emotions to others. We communicate in order to understand what other people are thinking and feeling, to express our needs, whether we want something or we don't want something, to get someone's attention, to share interests or experience over an extended interaction like a conversation. And of course, communication skills are also important for achieving goals at school or in a workplace. And so humans actually have a lot of ways that they can communicate with others, and we are usually using a combination of communication skills. So we might use spoken word to communicate like I am now. We also use a lot of non-spoken forms of communication like gestures, body movements, and facial expressions. And we might also use written language, typed language, sign language, or even symbols to communicate. And so speech-language pathologists work with people to understand the ways that are easiest and best for them to communicate, and also to teach skills to increase their ability to communicate with others more easily.
Thank you. So is a speech-language pathologist different from a speech therapist?
So this is a great question. We hear both terms a lot, and they are actually the same thing. So a lot of times when people are talking about a speech-language pathologist, they shorten this and just say SLP, or they might just say speech therapist. It's just a shorter way to say that. So all of those terms actually refer to the profession of speech-language pathology. They're just shorter ways to say or quicker ways to say it.
Yeah, that's great. So I can say SLP instead of speech-language pathologist. Or
yeah, it's a bit quicker, less of a mouthful.
Great. So we hear the terms nonverbal and verbal a lot. What does it mean by nonverbal? And does it mean the person cannot speak or make sound?
So this is a great question. The term nonverbal refers to a person who does not primarily use spoken words to communicate. So they may make different sounds to communicate and even have some spoken words, but they don't have the ability to use spoken words to meet all of their functional needs or social needs. So even children who repeat spoken language of others, but don't generate their own spoken words, that's what we call echolalia, can also be considered nonverbal or minimally verbal because they cannot independently use their spoken words. And lately, a lot of people are preferring the term non-speaking over nonverbal because it's easier to understand, but these terms do have similar meaning. So it's just really important to know that if a child or adult is nonverbal or minimally verbal, they still may be able to understand language at a high level that's being spoken to them. So we never want to underestimate a person who is not using spoken words to communicate.
Yeah, very true. So from now on, I should start to say non-speaking instead of non-verbal, right?
Yeah, a lot of people like that terminology better. SLPs are trained using the word nonverbal, but we know from the autistic community and the non-speaking community that they do tend to prefer non-speaking.
I see. So what does it mean when a SLP is working on speech?
Yeah, so working on speech or speaking is one skill that an SLP can address. So when we work on speech skills, we are helping people make their spoken words easier to understand. So this might mean practicing motor speech movements for speech sounds, practicing the speed of speech sounds or words, or practicing the clarity of speech sounds or clarity of voice. So the goal of working on speech is to help make the communicator easier to understand when they are speaking.
I see. Then what does it mean when a speech language pathologist is working on language?
Yeah, so working on language is something else that we do. And a lot of people may not realize that we also work on language. A lot of people know that we work on speech, but maybe not necessarily the language part. So when we're talking about language, this refers to the structured system that we're using to communicate. So it includes all of the commonalities or the rules that exist in a language that enable us to understand the meaning and to express ourselves. So people might need help learning or finding the words they want to use, putting those words in the right order, putting full ideas in the right order, or using the right grammar for that language. And language skills are important no matter if we're using spoken words, written words, or symbols. We also use nonverbal language skills like gestures, body movements, or facial expressions that we use to convey meaning or understand others. And language also involves social considerations. So that's what we call social language. So social language is a type of language system that allows us to make ourselves and others feel comfortable when we're communicating and interacting so we can make meaningful connections. So social language includes the ability to use language for different purposes. So saying hello versus telling someone about something you did yesterday versus asking someone a question. Social language includes the ability to adapt our language to meet the needs of the listener or a situation. So for example, we often talk differently to a baby versus an adult, or we may need to talk louder when there's lots of noise. And social language also includes following the unwritten rules of conversation and interaction. And this often involves skills like turn taking and also thinking about how our body language and facial expressions are also involved in communicating.
Wow, there's a lot to learn about speech and also about language.
Yeah.
So if a parent is worried about their child's speech or language, when should they contact a speech and language pathologist?
Yeah, so if you have concerns or questions about your child's speech or language development, you can contact a speech language pathologist right away. You don't need to wait to reach out for more information. SLPs are always interested to discuss speech and language development at any age. So also important to know that your child doesn't have to have a diagnosis of any kind, and you also don't need a referral from a doctor to connect with an SLP. So there are a lot of SLPs available in community preschool settings and school settings, and they also work privately. So you can find a private SLP using a professional search database that we have in BC, and the link for that will be shared at the end of this talk, so you can look that up if you're interested.
I see. So what does speech therapy look like for different communication challenges?
Yeah, great question. So speech therapy will often begin with an assessment. And so, or if your child has recently had an assessment done by an SLP, like through an autism diagnosis, for example, the SLP will just refer to the most recent assessment. But once that's been done and the SLP finds that there are some speech or language challenges or delays, they will begin treatment or therapy sessions. So speech language therapy looks a little bit different depending on what communication challenge is being addressed. So all speech therapy, all speech or language therapy includes the SLP teaching and modeling skills, not only to a child, if this is for a child, but also to parents, and then practicing the skills in a one-to-one session or a group format. And so for different communication challenges, this can look a little bit different. So for example, a child who's having trouble articulating their words clearly, the SLP will help to train their speech muscles like their tongue and their lips to coordinate their sounds more clearly. For a person who's nonverbal or non-speaking, an SLP may help that person to use other forms of their communication, like their gestures, body movements, and facial expressions. As well, they might introduce tools for communication, such as an alternative or augmentative communication device. And that would involve a device where a person is pointing to symbols or letters or written words to communicate. Also thinking about the social language side of things, a child who uses or a person who uses spoken language to communicate or non-spoken ways to communicate may also benefit from working on social language. So in that case, an SLP might work to help a person understand the perspective of other people in order to help them communicate in a way that makes themselves and others feel socially connected to each other.
Wow, there are many, many ways to help people communicate. It's amazing. Yeah. So we hear about social groups a lot in recent years. What is the difference between a social skills group and a socialization group?
Yeah, this is a great question because these terms sound very similar. And so a social skills training group is often run by an SLP or sometimes a behavior consultant or an occupational therapist. And in these social skills training groups, these professionals are teaching and practicing very specific skills that will help a person connect with others based on some assessment information. Socialization groups are a little bit different. So often socialization groups are called friendship groups or interest groups. And these types of groups are usually not run by an SLP or other healthcare professional because they're not really teaching those really specific social skills. So these types of groups might simply provide an opportunity for a person to meet other people around their shared interests. And that's also really important as well and can kind of go really nicely with someone who may be learning specific social skills in a social skills training group. They may also be part of some socialization or friendship groups as well.
Yeah, that's great. Thanks for the clarification. That make it more clear because often people have this confusion about what is a social group. Yeah. So last but not the least, do speech and language pathologists work with adults?
Yes, absolutely. So speech language pathologists support people across the lifespan. So a lot of times or many times SLPs support adults who have had an accident or health issue that's affecting their communication ability, like a stroke, for example. SLPs also work with the aging population. So we know that aging affects our cognition and our language skills. Or if an adult has recently been diagnosed with autism, they may want to connect with an SLP to practice skills that will make social connection easier for them. So if an adult is interested in accessing SLP services, there are some community services available, but you can also find a private SLP through the professional database that I mentioned earlier that would work with you in your home or community setting.
I see. So thank you, Chelsea, for your time to describe and explain all about SLP and speech and language therapy. It has been super helpful, and I'm wondering how can people reach out to you if they have more questions about speech therapy?
Yes, I'm always happy to talk more about speech language pathology. So if you have more questions, my contact information will come up now or at the end of this talk, so you can contact me directly. I will also give you the contact information for POPARD in case you're interested in learning more about the Provincial Outreach Program for Autism and Related Disorders. And of course, I will give you the link for BC Speech and Hearing, which is where you can find an SLP if you're interested in doing that.
Thank you so much, Chelsea.
Thanks so much, Stella.
Thank you.
Bye.